Good morning, everyone. We are the Group 1 and we are here to report about the mental retardation.
The definition of mental retardation. So, according to AAMR, American Association on Mental Retardation, defined mental retardation as significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior and manifested during the developmental period that adversely affects a child's educational performance. So this definition illustrates the important fact that the mental retardation label is assigned only when a student demonstrates both low cognitive ability and significant problems with adaptive behavior, that is day-to-day skills that are necessary for independence. The definition also clarifies that the mental retardation label is used only if the condition is present by the time the child is 18 years old below, which is the developmental period. It will occurring before or at the time of birth or infancy or childhood. It may also due to the factors by heredity that affect the development of the brain of child. These factors or causes will be discussed later on. So now let us discuss the degrees of retardation. The level of child's IQ and the ability of one's child according to his or her degrees of mental retardation. So the 55 to 70 IQ score, that is mild. Moderate is 40 to 54 IQ score. Severe is 25 to 39 IQ score. And profound is below 25.
Developmental characteristic of the mental retarded, and it has different kinds of categories: the degree of mental retardation, preschool age 0 to 5 maturation and development, school age 6 to 20 training and education, adult 21 and over social and vocational advocacy. First, we have profound. Gross retardation, minimal capacity in sensory motor areas, needs nursing care. Some motor development present may respond to minimal or limited training in self-help. Some motor and speech development may achieve very limited self-care, needs nursing care. Second, severe. Poor motor development, speech is minimal, generally unable profit from training and self-help, little or no communication skill. Can talk or learn to communicate, can be trained in elemental health habits profits from systematic habit training, may contribute partially to self-maintenance under complete supervision, can develop self-protection skills to a minimal useful level in controlled environment. Third, moderate. Can talk or learn to communicate. Poor social awareness, fair motor development, profits from the training and self-help, can be managed with moderate supervision. Can profit from training in social and occupational skills, unlikely to progress beyond second grade level in academic subject, may learn to travel alone in familiar places, may achieve self-maintenance in unskilled or semi-skilled work under sheltered conditions, need supervision and guidance when under mild social or economic stress. Fourth, mild. Can develop social and communication skills, minimal retardation in sensory motor areas, often not distinguished from normal until later age. Can learn academic skills up to approximately 6th grade level by late teens. Can be guided towards social conformity. Can usually achieve social and vocational skills etiquette to minimum self-support, but may need guidance and assistance when under unusual social or economic stress. Causes of mental retardation. It caused by incompletely understood psychological, environmental, or genetic factors without any evident damage of the brain, and by a number of specifically identified conditions or diseases. The causal and contributing factors included in each of these categories are as follows. First factor, diseases due to disorders of metabolism, growth, or nutrition. A number of disorders of metabolism, some of which are determined by heredity, produce mental retardation. Some of the most important of these disorders are phenylketonuria and galactosemia, in which there are abnormalities of amino acid chemistry in the body. Second factor, diseases due to unknown prenatal factors. Recent discoveries prove that Mongolism results from abnormal grouping of chromosomes, probably at the time of formation of the ovum in the mother. Other congenital malformations have a similar basis. For some, however, an undetermined prenatal mechanism must be responsible. Third factor, brain damage resulting from toxic agents which are ingested by the mother during pregnancy or by the child after birth. Jaundice of the newborn due to Rh blood factors incompatibility and carbon monoxide or lead poisoning are examples. Fourth factor, diseases due to uncertain causes but with evident damage of the brain. A sizable group of mentally retarded children have evident damage to the brain, which is presumed to be linked to the mental retardation. The causes of the pathology of the brain in this sizable group remain unknown. Fifth, diseases due to trauma or physical agent. Brain injury occurring as a result of difficult delivery and asphyxiation due to delay in the onset of breathing at the time of birth are common causes. They occur with particular frequency in premature babies. Brain injury in childhood, especially from automobile accident, is an added factor. 6. Abnormal growth within the brain. A number of rare conditions, some determined by the heredity, are characterized by tumor-like and other abnormal growths within the brain and produce mental retardation. Prenatal causes of mental retardation, it may be result chromosomal abnormalities and or not, such as chromosomal disorder, any syndrome characterized by malformation or malfunctions in any of the body system and caused by abnormal chromosome number of or constitution. Second, inborn errors of metabolism are rare genetic or inherited disorders in which the body cannot properly turn food into energy. The disorders are usually caused by defects in specific proteins or enzymes that help break down, metabolize, or parts of food. Third, developmental disorder of brain formation. It occurs prior to birth or in early childhood. They may be caused by genetic factors or can be brain injuries acquired through exposures to environmental factors such as fetal alcohol spectrum disorder, infection, physical brain injury, or drug addiction in the mother. Fourth is, during prenatal development, environmental factors can significantly affect the development of the child. Most everything the mother ingests, including food, liquid, and even medication, travels through the placenta to the fetus. Anything the mother is exposed to and the environmental affect the fetus. Next is perinatal causes. Perinatal is the period of time when you become pregnant and up to a year after giving birth. You might also have heard of the following term, antenatal or prenatal, meaning before birth. Anosmia describes an absence of oxygen reaching the tissues. Infants may be deprived of oxygen around the time of birth and sustain hypoxic brain damage, also known as hypoxic ischemic encephalopathy, or HIE. Low birth weight is a term used to describe babies who are born weighing less than 5 pounds or 8 ounces, equivalent to 2,500 grams. An average newborn usually weighs about 8 pounds. A low birth weight baby may be healthy even though he or she is small, but a low birth weight baby can also have many serious health problems. Syphilis and herpes simplex. Herpes simplex virus type 2 or HSV2 and syphilis are common sexually transmitted infection or STIs. HSV2 seropositive individuals have a lifelong risk of infecting their sexual partners. Postnatal causes of mental retardation occurs in the children that is born without any disabilities and later on they develop into mental retardation, either caused as a result of accidents or illnesses that occur as during childhood, such as biological, it occurs or being after birth, specifically of or relating to an infant immediately after birth, postnatal care. Second, psychosocial, relating to the interrelation of social factors and individual thought and behavior, the psychosocial care of patients. Third, child abuse and neglect. The World Health Organization or WHO defined child maltreatment as all forms of physical and emotional ill treatment, sexual abuse, neglect, and exploitations that result in actual or potential harm to the child's health, development, or dignity. There are four main types of abuse: neglect, physical abuse, psychological abuse, and sexual abuse. Abuse is defined as an act of commission, and neglect is defined as an act of commission. The care leading to potential or actual harm.
Here are the examples of disorders caused by prenatal. First is the Down syndrome. Down syndrome is a genetic disorder and most common abnormality in humans. This is the result of having problems with the chromosome 21, causing changes in the development of a children, resulting in both physical and mental abnormalities. It is sometimes called as a trisomy 21 because of the three copies of chromosome 21 instead of the usual two copies. Having this disorder sometimes has heart problems, short neck, flattened face. His or her language is delayed, and both his or her short and long-term memory is affected. Next is the Fragile X syndrome. Fragile X syndrome is the most common cause of intellectual disabilities that can be inherited. It is caused by the mutation of a specific gene of X chromosome, the Fragile X mental retardation 1 or the FMR1 gene that produce protein for brain development, and having this disorder is his or her FMR1 gene produce low level of protein or no protein at all for the development of his or her brain. A child having this disorder have prominent forehead, large ears, long faces, mood instability, aggression, and sometimes autism. Next is the Prader-Willi syndrome. It is a rare and complex genetic disorder that alters appetite metabolism. It usually starts at 2 years of age when having constant hunger. It is because of the lack of paternal gene in chromosome 15. It is characterized by having small stature, behavioral problems, defective sexual development, and uncontrolled appetite. Next is the fetal alcohol syndrome or the FAS. It is a condition that occurs in a child when the mother is consuming alcohol during pregnancy. It also depends on how much mother consumes alcohol while she is pregnant. So when she is consuming small amount, the child does not have any facial abnormalities but may cause behavioral problems. So when the mother consumes large amount of alcohol, the child may have the following physical feature: the small head, heart defect, bone and kidney problems. In cognitive disabilities, the child may have poor memory and judgment skills and have trouble in processing information. Phenylketonuria or the PKU, it is a metabolic disorder that can lead to severe brain disorder caused by the accumulation of the amino acid phenylalanine to toxic levels in the brain and blood. Without treatments, PKU can damage the brain and nervous system, which can lead to learning disabilities. Next is the toxoplasmosis. It is an infection caused by a parasite that is found in undercooked contaminated meat. And the mother who has this disease can possibly pass it to her unborn child. Symptoms can include eye infection that can lead to blindness. Let's move on to the perinatal causes disorder. First on the list is the hypoxia or the reduced oxygen to the brain that can cause long-term disabilities and development delays. Next is the anoxia, which is the term for no oxygen reaching the brain and can also cause disabilities or even death. Lastly, the postnatal causes. Postnatal causes occurs in the children that is born and later on develop into mental retardation, either caused by an accident or illnesses, like first, encephalitis, or the inflammation of the brain. It is caused by an infection caused by an insect like mosquitoes or an animal that have rabies. So that's why vaccination is a must to prevent this from happening. Next is the lead poisoning. Lead poisoning occurs when lead builds up in the body. Children younger than 6 years are especially vulnerable to lead poisoning, which can severely affect the mental and physical development. For example, inhalation of lead particles generated by burning materials containing lead and or ingestion of lead contaminated dust or water. Injury. Brain injury is most caused by near drowning, fall from bicycle, child abuse, playground equipment, and even by the severe malnutrition.
Differential diagnosis of mental retardation. We have physical examination. A medical practitioner examines a patient for any possible medical signs or symptoms of a medical condition. The configuration and the size of the head offer clues to a variety of conditions, such as microcephaly, hydrocephalus, and Down syndrome. Patients' face may have some signs of mental retardation that greatly facilitate the diagnosis. Next, neurological examination. The neurologic examination are typically examine the mental status, motor examination, sensory examination, coordination, and other reflexes. The mental status is an extremely important part of the neurologic examination. Then, we have laboratory examinations. This involves sample testing and urine and blood testing for metabolic disorders, chromosomal analysis, neuroimaging, and chromosomal abnormalities, which are the single most common cause of mental retardation found in individuals for whom a cause can be identified. We also have hearing and speech evaluation. Speech development may be the most reliable criterion in investigating mental retardation. Prevention of mental retardation. Prevention of mental retardation is discussed in terms of etiology and level of prevention, the primary, secondary, and tertiary. The aim of primary preventive medicine is to avert the disease before its onset. Secondary preventive medicine involves early identification and treatment of a disease to reduce its duration and severity. Tertiary prevention limits the degree of disability and fosters rehabilitation in chronic diseases. Special education programs and services. Early intervention programs is a service that assists both children with developmental delay and their families in order to prevent the illness to worsen. This program also includes speech therapy, physical therapy, and other therapies based on the child's needs. Today, the effort to meet the problem of mental retardation takes into place. We have diagnostic and clinical services. There are many clinics specializing established and services to the person with mental retardation. Special education. The number of mentally retarded enrolled in special education classes has been doubled over the past decade. Moreover, the teachers are specially trained to meet the specialized needs of the retarded students. To meet minimum standards, the teachers are required to go on a lot of trainings and seminars. Social services. Social services provided mentally retarded children and adults include casework, group work, and day care. These services are an integral part in clinical, rehabilitation, and other mental retardation programs. Social workers are also active in community organizations and in working with parents groups. Vocational rehabilitation. This includes rehabilitation sites that had been supported by the government and other private sectors and agencies. Then we also have the preparation of professional personnel. The government is now promoting the training of leadership personnel in education, rehabilitation workers, research personnel, and other medical and welfare specialists. In addition, programs are being provided that will increase the competence of the health professions in providing services for retarded persons. Parent counseling. Counseling of parents is now being provided by private physicians, clinic staffs, social workers, nurses, psychologists, and school personnel. Although this service is still an experimental stage of development, it offers bright prospects for helping parents to meet their social and emotional problems. And the last one, we have a bunch of research. Support for research in the causes and amelioration of mental retardation has been greatly increased. Progress has been made in identifying specific conditions and diseases and establishing basic problems of behavior and learning. There are now adequate understanding of pathological, genetic, psychological, environmental, and other causes that triggers mental retardation.
Now here we have different assessment for mental retardation. But before that, what is an assessment? Well, assessment is the evaluation for us to know if someone has mental retardation, and here we have three different assessments. First is the assessment for intellectual functioning. This refers to the evaluation of one's intelligent quotient if it meets the criteria for having mental retardation. And a great example for this is the Sanford Binet. Kay this approach focuses on identifying the IQ of an individual. Kay from the word itself, intellectual functioning, kani siya nga kuan mag-focus gini siya sa kanang pagkuha sa IQ sa usa ka tawo, kang mag-meet ba siya sa criteria kung na ba siya mental retardation or normal ba siya. Second is the adaptive behavior. This refers to the evaluation of an individual's performances, and this also includes surveys and interviews from parents, peers, and teachers. This does not only focuses on the individual's performances in the school, but also in the home or the household of the child, and this can be gathered through interviews from the parents. A great example for this approach is the AAMR Adaptive Behavior Scale. Lastly is through medical factors. In order to evaluate if someone has mental retardation, this should be done through gathering of information from the professionals. Furthermore, this includes asking professionals regarding the medications that should be done. Though we have different assessments, it should all be based by facts. No, okay, we can't just decide something through opinion only, especially with this kind of situations. Kay lain sad kayo mo na tawag kalit nga ulo si kuan ba kay feel na ko ubos yung IQ din mo na din mo judge din mo na din ta nga na siya mental retardation kaya ang consequences man na madaot ka, and then madaot po siya, then worst is mapriso ka or makiha ka. That is why in cases like this, all information should be based by facts. Now here we have three different transition planning. So what is transition planning? Transition planning kay process ni siya in order for someone who has disability can still achieve what he or she wants to be in the future. First, we have the adulthood transition. Now, because transition planning is part of individualized education program, this focuses on the development of students with disability to foster independence, which includes planning and using household budgets and etc. Great example ani kay finding employments nga siya na lang usa or developing hobbies and recreational activities. We also have parental or family perspective. Okay, gamit pud kayo ni siya kay we are all going to become parents man in the future, especially persons with disabilities. Kaning nga program is mag-help ni siya in order for someone, especially with katong mga tao nga with disabilities, to become a responsible parents in the future. We also have parental or family perspective. Useful kay ni siya kay we are all going to become parents man in the future, especially persons with disabilities. Kani nga program is mag-help ni siya in order for someone, especially with katong mga tao nga na disability, to become a responsible parents in the future. Lastly, we have the teacher. Teacher plays a big and important role in students' life, especially those with mental retardations. Teachers bring out the best of students. Teachers also help the students to identify their strengths and help them develop this to their maximum potential, especially kanang mga SPED teachers kay they will even create their own instructional materials just to satisfy the students' need to help them become better. And I think that would be all. Thank you everyone for listening.